Yes, welcome back, ladies and gentlemen. Good morning once again. I have the honor of chairing this session, which is also very close to my heart, that of inclusion and access to social services by women and other marginalized groups. So it seems we're a bit behind time. So without further ado, I would like to introduce and welcome Jonathan Tumwebaze, who is a PhD candidate at the University of Pretoria in the School of Public Management and Administration. His doctoral thesis focuses on child participation in child-focused policy designs. He holds a master's in research and public policy and a Bachelor of Development Studies, both from Uganda Christian University. And I would also like to welcome Ms. Nokwanda Mqadi, I hope I'm pronouncing it correctly. She's graduated with a Master's of Population Studies at the University of KwaZulu-Natal. She's interested in women empowerment, solidarity, and independence, and is currently working for an NGO, Broad Research Healthcare, as a data capturer. So the two are going to present for us, and they each have 15 minutes. So I'll start with Jonathan first, and then Pretty can follow. Thank you.
Okay, thank you very much, our chair. And I'll go straight ahead to my presentation. Thank you very much. So part of what I hope to do during this time of my presentation is in a way to contribute, or rather fit my conversations of child participation in child-focused policy design with an interest in social protection policy design, and see how that conversation fits into the grand discussions that we have had since morning. I think you can help me move the slides, or I could use the. Okay, so in terms of my presentation outline, I try in a way to give you a context within which these discussions are coming from. In that sense, I'll be speaking into the child poverty and vulnerability context in Uganda. And then after that, I will also be talking about children and social protection, trying to see how the conversations of social protection fit into Uganda's context, but also trying to share insights here and there from other contexts as well. And then the bulk of my discussion will be looking at these two questions that are still not definite in a sense, but still ongoing conversations as part of my doctoral research work. And my first question that I will be looking at is, what is the likelihood of recognizing children's participation in the policy design process in a contemporary adult-dominated society? And I don't use adult-dominated in a negative sense, but rather in an appreciative sense of the fact that this is the reality that, as I will be talking about as we go ahead. And then secondly, I'll also look at the role that listening to children's voices in nurturing particular forms of theory and practice contribute to in terms of coming up with child-sensitive social protection policies. And then from that, I'll draw some conclusions and then move forward. And so to this point, and I'm sure with each one, those present and those that are following us online, we all come to an appreciation of the fact that social protection and specific child-focused social protection is recognized globally because of its contribution in reducing vulnerability to socioeconomic natural shocks and other stresses, and also a key component when it comes to poverty reduction, as well as achieving equitable development. And also, as we have been seeing from right from the presentations that we had in the morning, and being specific, one that came from the Acting Director General, and that is Dr. I think was Mr. Chunu, Yes, he talked about, and together with other presenters as well, they talked about the place of the global agenda of the Sustainable Development Goal 2030, and also Africa's Agenda 2063. And at the heart of all these conversations that are happening is the need for an appropriate as well as an incentive compatible social protection policies and programs for the vulnerable populations. And that situates our conversations or what I'm trying to bring forward in the grand other conversations that are happening as well. And to this, I recognize the fact that conversations about child-focused social protection are appreciation of the fact that they call for not only an interdisciplinary approach in terms of how we think about child-focused social protection programming, but also a multidisciplinary approach, and to a better part, a cross-disciplinary approach, as you will be seeing in my discussion, that it's no longer the thinking of our of either or in terms of our policy engagements, but rather getting to a place of comprehensive thinking of a both and kind of thinking in terms of how we're thinking about child-focused social protection, because of the fact that the conversations cut across different disciplines. And our theorizing in terms of how we're thinking about child participation goes beyond one discipline to cater for other disciplines as well in that dialogue. And so the Ministry of Gender, Labor and Social Development in Uganda has adopted that multidimensional intervention that appreciates the role of the state and also non-state actors, and that has happened with programs that have been implemented. Specific is the Northern Uganda Social Action Fund that was funded by World Bank, the Livelihood Enhancement Program funded by the EU, the Food for Education Program implemented in IDP camps, funded by the World Food Program. And all these programs that are in place have a specific niche that targets children. But I'd like to make it clear that in them, right from the design of these kinds of programs, the level of appreciation of children's voices in these kinds of policy intervention has been at the tokenistic or tokenistic stage, really. It's not at the point of inclusive child participation in the design of these policies as well. And so the Ministry of Gender observes that, this Ministry of Gender in Uganda observes that the effect of child-focused social protection intervention programs on development lasts beyond childhood to enhancing transitions to adulthood. And there is a case that they build, a case that appreciates the role of recognizing the voices of children in policy design, in child-focused policy design intervention. So in this presentation, I advocate for child participation in design of child-focused policies, which is part of a radical endeavor. And I say that specifically because of these conversations are in a way cutting against the grain of the fact that you have institutional exclusionary, unintended exclusionary norms and values that are in place that in a way exclude the voices of children in that sense. Also the fact that there are other cultural dimensions which in a way impede child participation into the mainstream policy pathways. But also this is what in a way excites me, but also makes me in a way think more deeply about my work in this case, which looks at the picture of child poverty and vulnerability, which statistics speak for themselves in a sense that UNICEF Uganda in 2015 reported that children in Africa accounted for 25% of the global poor population, of the global poor children. Then this is projected to double by 2040 to 43 of the global poor children being in Africa by 2040. And also in Uganda's context, more than half of our population is below the age of 16. And also research by Uganda Bureau of Statistics shows that 36,000 households were headed by children, and 64 of those are in rural areas. So the point that I'm trying to make in this, that there is a place that children, there is a vulnerable position that children are in, but also in that vulnerable position, there are roles that they are playing, like family headships, contributing to the little income supports for their families through being involved in informal work. And so if children can play those parts or can contribute in such a way in their families, that means that as policymakers, we need to pay more attention to listening to their voices once it comes to mainstreaming child-focused policies. And in there also show that children and social protection interventions, the school feeding program in northern Uganda that had an impact in terms of school enrollment that increased by 9 percentage points, especially in terms of attendance of the afternoon classes, and other cases that I try to reflect on from Kenya, Eswatini, Zambia, and also some cases from South Africa that I'll not talk about now, but I hint about in my paper. And so what is the likelihood of recognizing children's participation in the policy design process in our contemporary society? And in this, I appreciate the fact that there are ongoing conversations that speak to the aspect of policy design, and this is attracting attention across the scholarly globe. Across different scholars that are involved in child participation work. And this is because of the complex nature of social problems, as I was talking about the cross-disciplinary, interdisciplinary, and all that kind of thinking that is happening. And this has forced people to start thinking about other innovative ways in terms of how to engage with social problem. And so this has spoken to the fact that policy design speaks to the specific policy goals, intentions, and directions, together with rational planning to achieve intended goals, in a sense. And I use the word rational planning in the policy-making process, being aware of the fact that there are debates that are informing the whole notion of rationality once it comes to the policy-making process. And I'm also cognizant of the fact that there are debates with regards to even conceptualization of the notion of what it means to be a child and how that is being conceptualized in different concepts as well. But I'm also aware of the fact that even the notion of participation in terms of children's context, there are also debates that are going on in that sense, which I'll not go into that. I hint about in my paper as well. Okay, so one of the models that I talked about that give insights that in terms of child participation is Hart's model that presents the different stages. And these are stages of participation. And the first 3 stages are the decorative stage, tokenistic stage, and the first stages talk about children being, you come for a conference that is child related and you have children decorated in place, and that gives an impression that children are part of this policy making process. And the deeper questions with regards to that, and in terms of which kinds of policies that makes. And the argument that I make in this, that conversations have to move from making policies for children to a place of making policies with children, and to, if we can get to a place of having policies being made by children, that can be an appreciated space. And I must say that there are pockets of these kinds of work that are going on in Uganda that I am happy to share at another stage. And these are some of the child participation models that I talk about that can give us a starting place in terms of designing child-sensitive social protection policies that have been applied in other contexts. And also, I try to make the point that there is a big gap that is still existing between child-focused policy theorizing and practice. And that is something that I try to further explain about in my work. And so what role does listening to voices of children have in recognizing and nurturing particular forms of theory? And in this, I appreciate the fact that the new postmodern ideas on children that I'm influencing, basically that look on the sociology of childhood, the rights movement, and all these are informing in terms of how we're new knowledge is being generated in terms of how children are taking center stage in policy design processes. And also moving to a place of recognizing children's voices in social protection and policymaking arena requires an empowerment theoretical approach, which appreciates the process nature of child participation in policy process. And the empowerment theory in place recognizes the status that children play and also the bottlenecks that they face and the power dynamics within the context they find themselves in.
Jonathan,
Yes. Thank you. And so I would like to share with us that, well, social protection has progressively taken root in Uganda, being specific to the senior citizens grant that is being given to the elderly person 60 years and above in northeastern Uganda, and 60 years in northeastern Uganda and 65 years in other parts. It has taken root. The integrated focus has been on the elderly persons who have no pension, and to a certain extent there has been a focus on women and youth, but direct child-focused social protection cash transfer programs are totally non-existent. And the pockets of what is happening is that which is being driven by UNICEF and other development partners, and in a way there's still a gap in that, which in a way makes me excited about what I'm doing, in a sense that it will contribute to the conversations that are happening, but also to theorizing further in terms of child participation in policy design processes as well. These are my way forwards. I will leave that running, but I would like to hint one, which is child-focused evidence-informed programming. As one of the recommendations that I make for the Ministry of Gender, as something that needs to be appreciated, and in a sense that the organizations that are in Uganda currently that are giving this kind of information, that listening to voices of children, following these particular kinds of models leads to these kinds of policies, and this is the evidence that we need for better policy programming. So I look forward to hearing your thoughts and insights as we go ahead. Thank you very much.
Thank you very much, Jonathan, for that engaging presentation. Without further delay, I'll move forward to Pretty.
Good morning, everyone. I will looking at on the perspective and experience of the young mothers who are recipient of the child support grant, a case study that was done in rural of KwaZulu-Natal. This is based on my master's thesis that was completed last year. So it more looks on since there is already existing information on how child support grant is used in general. However, I am focusing more on how mothers with more than one child use the child support grant. My content of my presentation starts off with the introduction, background study, rationale, research objective, research methodology, results, discussion, and conclusion. In a past presentation, they already emphasized the importance of cash transfers across the world and how it protects and provides security to vulnerable and disadvantaged people. And that it differs in each country, like middle income countries, it's driven by rights-based social assistance system, while as in most colonialized countries, it's driven by, it's stemmed from the system that was established by the colonial era, for which, for example, South Africa, with its legacy of segregation and inequality of opportunity, it contributed to a very high level of poverty and unemployment, which contributed, had a considerable effect on many families. So with the democracy, it came up with policies that actually recognize the importance of social security under the constitutional legislation. And South African Republic Constitution really guarantees the rights of children to basic nutrition, shelter, basic health, care service, and social services. And also it has proven to be well established compared to other developing countries, and large of its social spending goes towards the social grant. Getting into to child support grant. The child support grant is an unconditional cash transfers paid to the caregiver of eligible children, and it's one of the biggest of all grants in distribution numbers. And this child support grant was introduced in 1998 to reform the child protection system and to address object poverty. And that some scholars do highlight that underprivileged families rely on the child support grant to meet the basic need. And looking at the statistics, 59% of children live in poverty and live in income poverty, whereas 30% children live in households where no adult is unemployed, and 21.4 million children receive the child support grant. My rationale of the study is to investigate the society, as the society blames the child support grant of encouraging teenage pregnancy. Also, there is, as I said earlier, there's limited studies on how young mothers with more than one child use the child support grant. And also is to investigate if the child support grant improve child nutrition, health, and school outcomes. The objective of the study is to ascertain the perspective and experience of the young mothers who are recipients of the child support grant, to determine the role of the child support grant in improving the quality of life of the mother and the child, and to investigate the use of the child support grant by young mothers with more than one child. And the method used qualitative research methodology to determine how meanings are formed, and sampling strategy was purposive sampling. In-depth one-on-one interview were conducted, and it focused on the 15 young African mothers ages between 18 to 24 in rural of KwaZulu-Natal. And chemical analysis was used to identify patterns of information. Going to the results, the study focused on 15 mothers because a master's degree is actually limited. So that's why I had focused on 15 mothers. However, looking at their characteristics of sample, 9 mothers had 2 children, and that was majority of the mothers. The rest, it's only 5 that had 3 children and 1 had 4 children. And the level of education, only 2 had a master's degree, and 8 had a matric, and 5 were dropouts. And their occupation, it's only 4 were employed and 9 were unemployed, and only 2 were students. Those who were employed, they were earning less than 48,000 a year and less than 4,000 a month. That's why they qualified for the child support grant. And majority of these young mothers stay at home with their parents, and it's only 3 that were single parents and they're staying alone with their kids. So looking at the experience, the challenges young mothers highlighted that they experience, one of them is the psychological challenges. They say that it's very hard for them to cope, and they feel stressed and depressed most of the time. Also because they're still developing, or they're still maturing to adults. So sometimes it depresses them sometimes they get depressed as young mothers. So one of the participants highlighted that sometimes stress overpowers her, and she just wishes her child were a mistake. However, she does love her child, but because of stress and emotional, because she gets stressed and emotional, she just wished the child was a mistake. Also, the lack of support, especially from the father. This is the biggest issue in South Africa, where we have a lack of father involvement or father existent in the child's life. As the scholar highlighted that only half of South African men are on daily contact with their children, This really raises a concern in fathers involvement in their child's life. And some of the participants had highlighted that she actually expressed frustration and anger that the father of the child is a dog, he ran away, and he has no love or care for his children. Also, the other one said that he doesn't even remember the last time he actually saw or communicated with the father of the child. The next challenge is the education. Lack of education also contributes to high level of repeat pregnancy. This has come as where in society where there is lack of education or a lot of dropouts, it's seen as another contributor to young mothers continuing having children at the young age. And this participant reported that she's going to school, but then since there is no one to help her take care of the child, because as much as they're staying with their parents at home, it could be that maybe the mother is working or their parents are not around during the day. So she has to go to school and then come back and take the child to the clinic. And she also is aware of the other sacrifices young mothers make of dropping out of school to get a job so they can raise their children. Also, the attitude of healthcare providers. This is also a big concern. It was a big concern of most of the young mothers, because they feel as if now health facilities tend to be more of, they're very antisocial and anti-youth friendly. They feel always discriminated, they feel embarrassed and judged. And hence, the participant said that hence, since the research was based on the rural area, so the community is very small. It's like everyone knows each other. So by the time she goes to the facility to access condoms, her mother would already know the story. So there'll be gossips going around that she's sleeping around and why is she having condoms? So there's those factors like that actually limit young mothers to accessing the healthcare. The positive impacts of the child support grant. It's been reported that child support grant actually does contribute to social development steps, to providing income to the poorest and reducing income inequality. Also, that child support grant is an anti-poverty program that improves child nutrition, health, schooling outcomes. And two of the participants reported that she received 800 rand and used the money for the school transportation, uniform, and as to school items, and buying school bags, socks, and stationery. And the other one says she used the money to buy baby formula, nappies, and medication if the child gets sick. Also, there are negative impacts to the child support grant, which some scholars say that because it creates dependency on the country, and it encourages, as I said, it encourages teenage pregnancy to young women. Also, that some of the participants did say they believe that some of the young mothers misused the child support grant. This is based on their observation of the peer young mothers. Some, they highlighted that people misuse the money towards their nails, their hair, their weaves, and also towards alcohol. The discussion, the overall discussion, it does point out that child support grant is indeed used in different ways. However, it does show that it improves a family's human capital, education, health status, and economic growth, because it does not only support the child, but it also does contribute to the household needs and the parental needs. And also in poor household child support, it does not, as I said, it does not only benefit the child, but also the siblings and the parents. And most child support grant uses mostly on food, education, and transportation. So the recommendations, I would say sex education. Maybe sex education can be included in primary and high school, the way like life orientation classes to talk of sexual and reproductive health. Also the facility to add clinics at primary and high school, like your university, UKZN, does have a clinic within the facility. So that can also encourage young mothers to use condoms or other contraceptive. Also the cultural practices of virgin testing and circumcision to encourage young mothers to talk about this sensitive topic of sex. Also, these practices involve sexual and reproductive health. Also to encourage men to be more involved in supporting young mothers in their decision and learning about sexual and reproductive health. The other important one is the counseling for young mothers, because they already expressed they face depression and all that. So the support group and counseling can actually help them to feel better, and they find a platform to open up. Thank you.
I'd like to thank the two presenters for very interesting and engaging presentations. And I'll take this opportunity to open up the floor for questions and for those online. Thank you. So can we have questions?
Thank you very much for the presentation. Jonathan, I just want to find out if you consider gender in your research, because we know that maybe the girl child will be more disadvantaged than the boy child in terms of speaking out. For example, you may find that boy children would be more encouraged to speak up, and the girl child may not be encouraged in our culture to speak up. You know, in my culture, for example, I've seen young girls, young women sitting down and not saying anything, even at a meeting. But you know, the boys will be talking, and for us it would be like, oh, the children are actually speaking out, when in actual fact, the girl child is still left behind. And for Treaty, I can see that she presents the plight of the girl child, the young mothers. But I just want to find out what happens to the young fathers or young dads. Do they even exist? Where are they? Are they in school? What are they doing? Are they receiving a grant themselves? And what do they do with it? Do they even, you know, support their children? Because maybe they would like to do that, but it's just that society doesn't consider them as, you know, those who can sit with children, you know, and say, ha ha ha, forget it. We don't want anything to do with you here. So when we're talking about children, just asking whether we do consider the gender component. Thank you very much.
Grace.
Thank you, Chair, and thank you, presenters, for the wonderful deliberations. I wanted to inquire from Jonathan, did the status of women, most especially in Uganda, since your research is based in the country, did it have any bearing on the involvement of children in social protection? Because when you look at the realities that the social aspect or the culture aspects of the country affect the involvement of the different categories of people, including women and children. So in states where even women voices in engagements, especially if there are presence of men, they will be silenced. What of children who come last on the ladder after the women, after the men, women, then children? How, in your different methodologies, did you see how you see the involvement of women improving, helping the involvement of the children, whose voice really, the children in our culture should be seen but not heard? They are not allowed to have a voice. So in reality, how would they meaningfully engage on these issues, and which methodology would be used for them to understand what exactly social protection is even? Thank you.
Okay, in the essence of time, I'll give the presenters an opportunity to answer the two questions that have been asked, starting with Jonathan.
All right, thank you very much. And these are wonderful questions, And I must say that I'm very thankful that I'm getting this kind of feedback at this point. So thank you. I will look at this from 2 points, from two angles. The first one is the whole debate in terms of theorizing a child, okay? And in that case, there's one theory that looks at children, at a child as they conceptualize as a developing child, okay? And they look at as developing child from the psychological lenses, is seated there, just study them, okay? They cannot speak or contribute anything. Then the second category is the tribal child, where a child is seen as an occupant of an independent world separate from that of adult. And that world is reinforced by agendas and rules of world. Then the third category is adult child. A child is conceptualized as an adult child, where children are seen as competent participants in the shared space of adults. So policies that we make for adults still can work for the children. That's another. Then the last one is a social child, where children are seen as active participants, but involved in reciprocal learning with adults. So the way how a child is conceptualized in each context determines the kind of policies that proceed from that at the end of the day. Okay, so that's one way, which is something that as child-focused social protection policymakers, we need to pay attention to. That definition or understanding of a child is not homogeneous in a sense. And then children and gender. Well, that is something that I haven't been specific to pay attention to it at the moment. Not paying attention to see how the variables are playing out between boys and girls in terms of voices. Do boys and girls speak more on particular issues? But studies that have involved, which have been involved in menstrual hygiene in primary schools, looking at perceptions, attitudes and perceptions of both boys and girls, it was very interesting that the boys were more vocal than the girls, yet it is menstrual hygiene. And that helped us, in a sense, to develop a support system in that school that would incorporate boys as well. We can talk more about that in that sense. Then, in terms of the status of women with involvement of children, again, Grace, it's very wonderful. It's a very good question. At this point, I'm just thinking how the theories will lead out into the field. I think I will explore that more once it comes to my primary data and see how that is playing out after that. But I'll be happy to share my findings later on. Thank you.
The perceptions and the question agenda. Okay.
Starting off of considering a gender question, I think on my recommendation, I did highlight that there's actually a gap on men involvement. So these circumcision programs can actually intervene, or they can actually include information of sexual and reproductive health, and also involve how they can go about supporting women and understanding women's rights, because there is a huge gap in that. Also, you asked the question of where are the fathers? And most of the women I've interviewed, they actually spoke about themselves, also what they observe in the community, that some fathers are there within the community, but then because they feel as if because they're not financially fit, they should not be part of the child's life. Because they're not, others can be work employed and whatnot, but because the pressure is left with women, they can just choose to support whenever they feel like. So there is no pressure on men to actually support, they just do as they please. Also, you asked the question of if young mothers actually receive the child support grant. Majority of, actually all my participants were receiving the child support grant, and they were actually taking care of their own child. As I said, none of them had a grandmother looking after the child or receiving the grant for them. It was them, even those who were employed, they were able to take the child to the creche while they go to work. So they were receiving the child support grant, of which is why they reported that other young mothers misuse the child support grant. Those are the ones, maybe they have a grandmother at home who takes care of the child. So the money doesn't go directly to the child's need, and then they misuse it. Thank you.
Any questions online? Tim, are there any online questions? Nothing. Any more questions from the floor? Okay, so I think I'll conclude by thanking our presenters once again, and maybe leaving with the food for thought that the issue of child grants has reared its ugly head again, of whether it's beneficial or not. So we can think along those lines. And I would like to call a close to the session, and I thank you for your indulgence. Thank you.